Good afternoon. On Friday, Canadians learned that based on current projections, approximately 2,000 Canadians are at risk of dying from COVID-19 per month if we stay on the current track. This week, we learned that the United States estimates that 20 million people across the U.S. will be vaccinated in December for COVID-19, with 30 million per month after that. So this means that the United States has a plan in place to vaccinate the equivalent of the Canadian population by sometime in the middle of January. Today, we're hearing from provincial health ministers a lot of confusion after weeks of confusing and conflicting information from the federal government on basic questions like when Canadians can expect to be vaccinated, whether or not there's a comprehensive plan for rollout, and whether or not the provincial governments have been included in these discussions to the point where they are ready to assist in the rollout. When you put all of this together, what this means is that while countries around the world, people in the United States, the UK, Germany, 26 European nations and onwards will have the ability to be vaccinated against COVID. But in Canada, we will likely see 2,000 plus deaths per month because we don't have the same ability. Later today, the health minister will be appearing before a committee of the House of Commons for 4 hours. And the primary question that she is going to have to answer is in April, when many countries around the world have already rolled out the COVID vaccine, if she'll be able to look into the eyes of 8,000 Canadian families who have had loved ones pass away, if she's going to apologize to them for their deaths because we haven't been able to roll out a vaccine. And that's really what we're talking about here. I know that sounds stark, but Canada's inability to be clear on these details, to have a clear plan when countries around the world have treated this with military efficiency, with the level of severity that it's needed, it results in deaths. It results in the mental health crisis that we're seeing across this country because of prolonged economic lockdown. And the other thing that I want to know beyond that stark figure is if we are not likely to have a vaccine anytime soon, or if we don't have a plan to do that, then what's plan B? Can we rely on more targeted measures around rapid testing? Where are at-home testing? Where are we at with therapeutics? It has been so deeply frustrating as a member of the opposition to try and get any answers out of this government, but we're going to attempt to do that tonight. I would just say this. Typically, a late night House of Commons committee is something that it's not necessarily must-see TV, but tonight, I hope every Canadian tunes in and watches this because we need to have a plan. What has happened today, for me to see provincial health ministers not have answers this close to when other countries are about to roll out the vaccine is just mind-boggling. And this is not a partisan issue. This is about the health and safety of Canadians as we go forward. So we will be calling upon the government for a series of answers related to logistics, how we're moving forward, and we expect answers tonight. Thank you.
Merci, Michel. Bonjour tout le monde. Écoutez, la situation actuellement est très différente de ce qu'elle était il y a quelques mois. Souvenons-nous, au début de la pandémie, l'impact financier sur les citoyens était la priorité numéro 1. On a travaillé avec le gouvernement afin d'aider à avoir les programmes pour aider les entrepreneurs, les citoyens à passer à travers les mois où ils devaient être confinés. Mais là, maintenant, la situation en est une prioritaire de santé publique et de survie. Comme ma collègue vient de mentionner, le Canada, vendredi dernier, la santé publique a évalué qu'au Canada, on pourrait avoir jusqu'à 2000 morts par mois. Là, actuellement, les Américains sont en train de vont déployer le vaccin très bientôt. Et l'évaluation du côté américain, c'est qu'ils sont en mesure de traiter, de vacciner l'équivalent de la population canadienne en 1 mois et demi. Ça veut dire que d'ici fin janvier, mettons, l'ensemble du Canada pourrait être vacciné si on avait les mêmes ressources que nos amis, nos collègues américains. Justin Trudeau a déclaré que c'était parce que le Canada n'a plus de capacité de production nationale de vaccins qu'on a du retard. Mais n'oublions pas qu'au mois d'août, le gouvernement a déclaré que le Canada serait en mesure de fabriquer 250 000 doses de vaccins d'ici novembre. Eh bien, je pense qu'on est en novembre actuellement, même le mois de novembre achève. Qu'est-ce qui s'est passé? C'est une des questions qu'on va demander. Le premier ministre également ne peut pas dire aux Canadiens à quel moment les vaccins vont arriver. Son ministre des Affaires intergouvernementales a utilisé 3 calendriers différents lors des entrevues hier soir. Il a dit janvier, début 21, premier trimestre. Donc, ça commence à être assez diversifié comme réponse. Pour les petites entreprises qui ont du mal à rester ouvertes ou les enfants qui s'inquiètent de savoir s'ils peuvent rencontrer les personnes âgées, il y a une grande différence entre janvier et fin mars. Les pays comme les États-Unis, le Royaume-Uni, l'Union européenne en général, le Brésil, l'Inde, vont tous passer avant le Canada pour la vaccination. Il y a 2,7 milliards de personnes, soit le tiers de l'humanité, qui est en avance pour la vaccination versus le Canada. Je ne crois pas qu'on est ici pour faire de la petite politique. On n'est pas ici pour jouer un rôle d'opposition qui cherche des prétextes à faire de l'opposition. Moi, je vois la situation actuelle, c'est une des plus grandes crises que le Canada a vécues, que l'humanité vit depuis des dizaines et des dizaines d'années. Et j'essaie de m'imaginer comment ce gouvernement aurait pu gérer la situation lorsqu'on était en Deuxième Guerre mondiale. Des décisions qui étaient difficiles, qui exigeaient de la rapidité, de l'efficacité, d'être opérationnel. Ce que les gens qui nous ont précédés ont fait ici est un travail remarquable. Là, ce qu'on demande, tout simplement, c'est d'agir et donner les bonnes réponses. Parce que les provinces actuellement, comme la province de Québec, par exemple, le ministre de la Santé au Québec a envoyé 2 lettres. Le ministre de la Santé n'est même pas capable de parler directement à la ministre. Il doit envoyer des lettres à la ministre de la Santé du Canada pour avoir des réponses. Il n'a aucune réponse. Donc, pour nous, ce soir, nous avons un comité plénier en chambre. La ministre de la Santé va être là pendant 4 heures pour répondre aux questions. Comme Michel a dit, ce n'est pas le genre d'événement où les citoyens se branchent devant leur télévision pour écouter. Mais je crois que vous, les médias, et les parlementaires de tous partis devront être attentifs aux questions qui vont être posées par les membres de l'opposition et surtout aux réponses qui vont être données par la ministre de la Santé. Parce que, comme on mentionnait au début, il y a des vies en jeu. Dans une situation où les vies des Canadiens priment et on doit avoir des réponses pour éviter d'arriver dans 3 mois avec une accumulation de mortalité, des gens qui sont décédés parce que leur gouvernement n'a pas agi assez rapidement. Merci.
We'll start with a question on the phone. Opérateur, nous sommes prêts pour la première question au téléphone.
Thank you, merci. The first question is from Ryan Tumilty, National Post. Please go ahead.
Yeah, hi there. We've heard sort of consistently from the government that their reason for the lack of transparency is to protect their ongoing negotiations. I'm wondering, especially Ms. Rempel Garner, you've been in government. Do you buy that answer?
I can find more information about the American rollout process or the German rollout process or the Israeli rollout process than I can about the operations of my own government. And that's ridiculous. I mean, today you don't have to take my word for it. Provincial governments are saying the same thing. We've got Manitoba, Saskatchewan, Ontario within the last 24 hours saying that they don't have details. And they're the ones who are going to be tasked with doing a lot of the heavy lifting on rolling this out. That is just complete bunk. And the government needs to inspire the Canadian populations right now with a very clear plan. We should be educating the Canadian public about what the rollout's going to look like, how people participate, where they're going to participate, who is prioritized and for what reason, so that we don't continue with this mass uncertainty and mass chaos that the federal government is perpetuating. There's no reason for their lack of transparency outside of the fact that they don't have a plan to present the Canadian public. And that is due to a lack of leadership and what I think is becoming very apparent, gross incompetence.
And then just to follow up, you touched on this, it will be provincial health authorities and even local health authorities who actually put the shot into people's arms. I'm wondering how concerning it is that, like you mentioned, they don't seem to be fully informed about the plan.
I don't actually have words for how concerning it is. I mean, how's the provincial government supposed to roll this out if they don't know how many doses they're getting, on what timeline, what support the federal government is going to be providing, what the approvals process looks like, what if the federal government's going to take a role in education or tracking? I mean, these are basic questions that should have been answered months ago. What has the government been doing for 11 months? I mean, it's not a surprise that the vaccine was going to be required, or that there were companies working around the world with it. I mean, this isn't at the 11th hour. Provincial government shouldn't be asking this question. And I'll just go, I'll use the United States as an example. I mean, for the United States to be able to say with a degree of certainty that they're going to be able to vaccinate the equivalent of the entire Canadian population in a few weeks' time across 50 jurisdictions, I mean, they've been able to figure it out. Why can't we? And it's not the fault of the provincial governments. This is dropping the ball on the federal government's part when it comes to approval, procurement, manufacturing writ large. And the time for excuses is over. And the federal government has to come out and be very clear about how they're going to proceed. And that's what we're going to attempt to coerce out of them this evening.
We'll now take a question in the room.
Hey, Glenn McGregor, CTV News. Ms. Rempel Garner, we heard this morning from a Health Canada official saying that she is expecting a decision on approval of the first vaccine candidate, that is the Pfizer product, will come around the same time as the U.S. and European regulators make their decision. We know that's going to likely be around December 10th or 11th. And as you said, the Americans are expecting to start inoculating people right away. The delay here seems to be on the procurement side and the delivery of products that we are contracted to obtain. What should the government have done differently in that part of the piece of the equation to ensure we get vaccines sooner and not have to wait while everybody else gets theirs?
So my understanding is that in the U.S., there was a lot of thought, as an example, given to what happens between the date of approval and then how the rollout happens, right? So we should have been giving the same level of consideration, right? Like what does the project timeline look like? I feel like there's been a disconnect between the federal government's approval process and any sort of planning with the provinces on rollout. So that's step number one. It's very clear that the provinces haven't been brought to the table in a meaningful way, and that's what should have been done right from day one. It's very clear that there's a disconnect there. The second thing is, I don't think, and I mean, there's not clarity on this. We don't even know how many doses are coming in, right? So that makes it even more difficult for the provinces to plan. By now, the Canadian public should have a very clear understanding of who is going to receive vaccines and on what timeline, the priority consideration. That's something that should have been done long ago. Also, I think today is the first time we've heard any talk about logistics, but we still don't have details on, things like syringes, gloves. I don't understand how we're going to be recording who is receiving a vaccine or not. These are all things that should have been done a long time ago. I guess my question would be this. I don't think that a vaccine task force was struck in Canada until June, if I'm correct. Why? And what have they been doing all this time? Have they been providing advice to the federal government? And was that just ignored? And why weren't the provinces looped into this in a meaningful way? I think it's a very sort of rare thing to watch provincial health ministers verbalize this concern in this way. It's a bit out of sync with what I think has been a collaborative process thus far. This is very concerning for provincial governments to be questioning basic logistics. I don't think it bodes well for Canadian prospects to receive a vaccine in a timely fashion.
In terms of the delivery of the actual doses, are you concerned that we haven't seen the contracts, obviously?
Right.
But that we are not a priority customer, and that we'll have to, regardless of logistics approvals, in terms of just the delivery of the product, we're going to have to wait while other countries that are higher priority get theirs.
I actually think that's a certainty at this point in time. We know that Canada, from the government has not been clear on where we are on the list for delivery, but all evidence at this point shows that we're going to be well behind the United States, Germany, the UK, other countries around the world in receiving the vaccine. There will be a time to try and understand why this happened. And frankly, again, to be very blunt, lives lost to COVID during this time will be directly accountable or related to that answer. I think that there's also a lot of questions to be asked, a lot of confusing information around manufacturing capacity in Canada. It troubles me that the government in early days hitched all of their hopes to the CanSino vaccine. And it wasn't until other countries started to sign contracts with some of the major candidates that we started to hear about Canada starting to negotiate or getting a deal, which to me suggests that we were behind right from day one. But at the end of the day, I think Canadians at this point, they don't want to hear that. I think my first job is to pressure the government to tell Canadians those very basic facts. When are we getting a vaccine? In what order? Where do you go to get a vaccine? What can you expect? What sort of immunity is going to be expected from this? And what we're seeing is panic and chaos in the federal government, and that doesn't help people separated from families. It doesn't help people that are sick, and it certainly doesn't help the economic climate in this country. So when the government delivers its economic update, this issue is going to be very much tied to that, and they better get it together.
Next question on the phone. Opérateur, prochaine question au téléphone.
Thank you, merci. La prochaine question est de Raymond Filion, TVA. La parole est à vous.
Merci. Bonjour. Une question pour M. Paul-Hus. La santé publique nous parle aujourd'hui de 3 millions de Canadiens qui seraient vaccinés dans les 3 premiers mois de 2021. Le Dr. New de la santé publique a aussi dit que les Canadiens, on est patients et prudents, que ça fait partie de notre mentalité. Mais sentez-vous que les Canadiens comprennent le délai dans la livraison du vaccin?
Non, merci pour la question. Donc, premièrement, de dire dans les 3 premiers mois, encore une fois, on ne sait pas si c'est dans 3 mois ou un peu avant. Ça, c'est encore pas clair. 3 millions de vaccins, on parle de 1,5 million de personnes, parce que ça prend 2 vaccins par personne. Donc, on parle d'une...
Non, c'est 6 millions de doses. Okay, 6 millions de doses attendues dans les 3 premiers mois, donc 3 millions de personnes vaccinées.
Donc, 3 millions de Canadiens, mais surtout de se faire dire que c'est dans la mentalité canadienne d'attendre, de comprendre ça, non. Lorsqu'on parle de vies qui sont en jeu, des personnes, surtout les personnes âgées ou les personnes qui ont des maladies qui sont confinées depuis plusieurs mois, on ne peut pas dire que comme Canadien, on peut comprendre. Non, absolument pas. Pour moi, le gouvernement canadien doit répondre beaucoup plus clairement à ça et surtout expliquer pourquoi on est en arrière de tous les autres pays du G7 et d'autres pays de l'Union européenne. C'est incompréhensible et c'est pas vrai qu'on peut se permettre d'accepter la situation comme si c'était une fatalité et que le Canada avait un grand cœur. Il y a des vies en jeu actuellement.
J'aimerais aussi, M. Paul-Hus, vous entendre au sujet des révélations de ce matin concernant les casinos. Le tapis rouge qui a été déroulé pour des membres du crime organisé, qui a pu y faire du blanchiment d'argent notamment. Qu'est-ce que vous en pensez et est-ce que le gouvernement fédéral doit intervenir, doit faire quelque chose par rapport à ça?
Bien, actuellement, au niveau de tout ce qui est argent du crime organisé, au niveau fédéral, il y a le FinTrack qui fait des suivis là-dessus. À partir du moment où l'information est donnée aux provinces, c'est sûr que là, je référerais au gouvernement du Québec parce que le casino est géré par le gouvernement du Québec. Mais d'un point de vue fédéral, bien entendu, on doit s'assurer de donner l'information adéquate et c'est aux provinces maintenant de prendre des décisions.
Next question in the room, the Canadian Press.
Chris Reynolds, Canadian Press, I have a question for you, Ms. Rempel Garner. To what extent is the discussion around vaccine procurement and distribution, the entire vaccine process now, just becoming overly politicized?
That's just ridiculous. People need a vaccine. We don't have details on how we're going to get it. This is the single greatest public challenge that's faced our country in decades, and we don't have answers on it. In a healthy democracy, when we don't have answers, it is the role of parliamentarians to press and hold the government to account so that we get it. in this scenario, I can say with pride that the work that myself, my colleagues have done have resulted in the government moving on things like rapid testing. That wasn't even in the public narrative 2.5 months ago. And frankly, I think that the government is moving on this because we're asking tough questions. I'm tired of the implication that demanding answers and transparency is somehow a nefarious thing. People's lives are on the line, people's jobs are on the line, and that sort of an excuse is something that I think a weak government looks to, as opposed to providing leadership in a moment of crisis. That's what we're asking for, and we're proud to do that.
Vancouver City Council has just passed unanimously a motion to ask Ottawa for permission to decriminalize simple possession of drugs. Is this something that you support?
Well, I'm certainly very concerned about the very large increase in opioid-related deaths across the country. In my province of Alberta, we've seen a massive spike. Ontario data just came out. So this is a crisis that we have to deal with. I do think that this is an issue that has been exacerbated by the COVID pandemic and economic lockdown. So action is needed. What I'm hearing from across the country right now is a lack of access to rehabilitation services, everything from day programs to mental health services that are in part related to the COVID restrictions, but also because of a lack of comprehensive planning across the country to provide those resources. I think that what we need to do is take a patient-centric approach to this. We need to put compassion for somebody who's struggling with addiction at the heart of our policy intervention. And I think we have to ask ourselves what the role of the government is. In this instance, I think there's many aspects. First, I think that we shouldn't be looking at, punishing people that are struggling, but rather really throwing the book at people who are producing and distributing these substances, which have no place in Canadian society. They ruin lives. They're not put on one demographic. They touch every aspect of Canadian society. But government also needs to have a plan to provide a path to recovery. And I don't think that right now that's inadequate. We don't have adequate resources in the country. So without a plan to put people on a path to recovery in a comprehensive way, meeting them where they're at, I'm worried that we're just losing a way for the government to intervene. So I know that this is a debate that will likely come before Parliament, but our approach as a party will to put compassion and the compassion for somebody who's struggling at addiction at the heart of any decision that we make.
Next question on the phone. Opérateur, prochaine question.
There are no further questions. Nous n'avons plus de questions pour le moment.
Question on addiction.
Yes.
Another addiction is gambling addiction, and government today is moving to legalize single event betting in Canada. Any thoughts on this?
Yeah, I heard about this bill being tabled just as I walked into the House. We've had, this debate has come up in parliaments, since I've been here. I would just say this, my focus today is on figuring out how Canadians are going to get a vaccine, and if this is the government's priority at this point in time, maybe they should be looking at vaccine production. Thank you.